Well, this is the sound you're going to hear. A little clicking sound, kind of like popcorn being made.
When I came in for my checkup, they told me I had a cavity, and then he told me that it's small and I'm a good candidate for the laser.
You doing okay? All right. Remember, you raise your hand. Probably within 7 to 10 years, the ability to actually cut hard tissue, in other words, tooth or bone, with the laser has just sort of evolved. And now what that's allowed us to be able to do is cavity preparations, bone and gum surgeries, crown lengthenings, anything that where you once would have to use a scalpel and rotary instrumentation to physically remove, we now can do simply here in the office.
It made me a lot less nervous for the procedure because the numbing process is the most painful part of the filling, you know.
Even the anticipation of the injection is enough to make patients uncomfortable. Whereas we once had to anesthetize for every procedure, now we don't have to do that. So that means less shots, sometimes no shots at all. They come in, it's done, and they leave the same way they came in. There's no feeling of heaviness in their lip, no puffiness, no droopiness. They can eat and drink right away. If the laser doesn't cut, the term is ablate, because the actual tip of the laser doesn't touch the tooth. Everybody hears laser and they think, you know, from TV or the movies, the sci-fi movies, it's some, you know, crazy beam that's gonna, you know, cut through everything. But once they've experienced it and have gone through it, and we've spoken afterwards, and I've asked them what they felt during the process, how it went, a lot of them aren't even aware that the tooth was actually physically cut, you know, worked on. Did you feel that at all?
No.
A perfect answer.
Initially, when he was prepping the tooth with the laser, I didn't feel anything. And then when he said he was actually drilling, I didn't feel anything besides a little bit of water and the suction, and that was about it. It was very painless.
The procedure's over, you can eat, you can drink. That change for the patient, that comfort change, it's win-win, you know, it's a home run.